What does a DCIS pathology report tell you? Imagine you've just had a biopsy to check a suspicious area in your breast. The pathology report that comes back is like a detailed map of what's happening inside your breast tissue. If the report says you have ductal carcinoma in situ, or DCIS, it means there is non-invasive cancer confined within the milk ducts. This is important because the cancer has not spread beyond these ducts into the surrounding breast tissue. The report confirms the presence of DCIS and often specifies whether it's a pure form or if there are any invasive cancer components nearby. The report also describes the grade of the DCIS, which tells your doctor how abnormal the cancer cells look under the microscope. The nuclear grade ranges from low to high. Low-grade DCIS cells look more like normal cells and tend to grow slowly. High-grade DCIS cells look very abnormal and tend to grow faster. Knowing the grade helps predict how aggressive the disease might be and guides treatment options. Size and extent are also detailed in the report. It estimates how large the area of DCIS is within your breast tissue, often measured in millimeters or centimeters. Larger areas may require more extensive treatment to reduce the risk of recurrence. The report also notes the surgical margins, which are the edges of the tissue that was removed. If cancer cells are found at the edges, called positive margins, it suggests some DCIS might still be in the breast. Clear margins, or negative margins, mean the cancer was fully removed, but sometimes additional surgery or radiation might still be recommended. Hormone receptor status is another key piece of information. The report tests whether the DCIS cells have estrogen or progesterone receptors. If they do, hormone therapy might be an option to help lower the risk of recurrence. The report also looks at HER2 status, a protein that can promote cancer growth. If the DCIS overexpresses HER2, it might influence the choice of targeted therapies. The report may describe the microscopic growth pattern of the DCIS, such as comedo, which is a high-grade form with necrosis, or other patterns like solid, cribriform, micropapillary, or papillary. These features can provide additional clues about how the DCIS might behave. Sometimes, the report notes whether microcalcifications are present. These tiny calcium deposits often show up on mammograms and can be associated with DCIS. Finally, the report might mention other findings, such as atypical ductal hyperplasia or Paget disease, if they are present. It may also note benign changes or other microscopic details. While the report is primarily written for your healthcare team, understanding its key points can help you participate more actively in your treatment decisions. Always discuss your report with your doctor to understand what the findings mean for your specific situation and what steps are next. In summary, a DCIS pathology report provides a comprehensive look at the diagnosis, grade, size, margins, hormone receptor, and HER2 status, and microscopic features of the DCIS. This detailed information helps your medical team decide on the best treatment plan to manage the condition effectively and reduce the chance of it progressing to invasive breast cancer. Remember, every case is unique, so personalized medical advice from your healthcare provider is essential.